For question 7, it asks, what is causing the uterine artery blood flow to increase from pre-pregnancy to pregnancy during a normoxic pregnancy? First of all, normoxic pregnancy just means a normal pregnancy that is at sea level and not at elevation or altitude or anything like that. And so how the uterine artery blood flow increases from pre-pregnancy to pregnancy is that the total vascular resistance decreases, which allows more uterine blood flow. And so how the total vascular resistance decreases for the uterine artery is there is an increase in nitric oxide production, which then further leads to vasodilation. And so nitric oxide is a local factor that is, when released, vasodilates our blood vessels, allowing more blood to travel through our blood vessels because it is facing less resistance, and nitric oxide production being released overall decreases the total vascular resistance. And so in this case, more nitric oxide is being produced because on the onset of becoming pregnant, vascular endothelial growth factor and placental growth factor are both released, and they go and bind to the placenta, and this causes the placenta to release more and more nitric oxide. And when more and more nitric oxide is released, that means that the blood vessels around the placenta and that area will vasodilate due to the local factor of nitric oxide being released, and that therefore decreases the total vascular resistance of blood flow to the placenta and further the uterine artery feeding the placenta. And so blood flow to the placenta flows from the aorta to the common iliac artery to the internal iliac artery to the uterine artery. And so the decrease in vascular resistance of the uterine artery is greater than vascular resistance of the internal iliac artery, which allows more blood flow to the uterine artery and to the placenta to be able to support in the baby and give the nutrients to the baby and all that sort of stuff. So since the vascular resistance is greater, the blood wants to flow to that area because it's facing less resistance than in the internal iliac artery. And the blood vessels feeding the uterus and the placenta vasodilate more than the internal iliac artery, allowing, like I previously said, more blood to flow because it's facing less resistance. And so more blood is already being sent to the uterus and the placenta from pre-pregnancy to pregnancy, and how more blood is sent to the placenta and to the uterus for pregnancy is through that decrease in total vascular resistance due to the increase in production of nitric oxide because of those growth factors being released and binding to the placenta, causing the placenta to release more nitric oxide, and therefore more vasodilation, decrease in total vascular resistance.